The Asthma and Allergy Foundation of America perennially ranks Richmond in the top 5 most challenging cities to live in with asthma.
Frequently when children are absent from school and we've reached out to a parent to find out what's going on, they will report that their child is sick. And when we dig a little deeper, we discover that often it's a diagnosis of asthma.
If you don't control your asthma, you can end up in the hospital a lot more. You can miss time from school, which will affect your education. You can also miss time from sports, which can affect your body and staying healthy.
The highest incidence of child hospitalization and ED utilization happens in zip code 23223. And so it's really pushed us, the health department, the health systems, the local school systems, to start thinking differently about how we're going to work together to support families through this.
It's like everything starts for him at the same time, so it's really nothing easy for him. It's not easy for him to be out here. When I found out he had asthma, I was scared and nervous. I almost lost my son twice from asthma.
Fragmentation of care and services has been a problem here in Richmond. So the idea that all of these different players and potential partners are beginning to work together is really encouraging.
We've been partnering with the health department for the past 2 to 3 years on the Resource Center initiative. Our role has been to hire community health workers. They work seamlessly in the Resource Center setting with the health department staff, helping to support the providers as well as engaging with the residents, identifying barriers that they may have and linking them to services.
The Resource Center is a satellite clinic. We offer different resources for our families that live out here. I have pamphlets, I have videos. The health department does have a healthy homes program, so having somebody to come out into the homes and inspect and what to look for in the homes and different triggers.
These healthy homes teams that are going into children's homes and assessing the environment and working to educate and support families. It's a great example of where the clinicians can't do it on their own, right? There are environmental triggers that contribute to disease, and so the health department has developed a lot of partnerships.
Working collaboratively to help improve the system of care, helping to assure that there is support within the school system to help manage crises, and then also working in the home to help identify and remove triggers that could cause asthma exacerbations.
The Department of Health, I think, is a step in that direction where they can get great care regardless whatever office they're in, and that they get the same educational tools to use to stop and recognize asthma.
We have been able to make some measurable changes in the outcomes of children that we've taken care of. We've been able to document some decreases in emergency room and hospital usage.
One of the ultimate measures of success is that the families and children experience a better quality of life, reduce stress among their parents who are helping to manage their asthma.
Just knowing that parents can come together and work together to develop a plan between their doctor, the school nurse, themselves, the teacher, just to kind of wrap all of our hands around their babies.
Part of the work that we're trying to do is really reshaping the culture around asthma and helping kids and their families understand that they can lead fairly normal lives and that they can engage in activities, building these systems and supports together and changing the potential of these kids with asthma.